Let's take a look at Sofia Vergara throughout the years and see if we can spot hints of facial plastic surgery procedures along the way. Cost of the possible procedures and the before and after will be revealed at the end. Before we get into it, I just want to remind you that we have a weekly newsletter that talks about hair loss and offers information on hair restoration. Be sure to subscribe to it at hairlinesnews.com. In 1986, at the age of 14, what I'm seeing here is grayed bony complexion of the upper middle face and lower face. Her nose is natural, but also it resembles that of many people who are post-rhinoplasty because it looks so good. I can see that Sofia has thin nasal alas, and that indicates to me that she has relatively thin nasal skin. So if she were to get a procedure, any changes to the underlying cartilaginous or bony structure will be more obvious from the outside. Sofia has a short philtrum, well-defined philtral columns and a cupid's bow, and upper tooth show on repose. She has many of the beauty traits that we speak about in our videos that hold up well over time. So Marco included this video for my review, but I can really only catch a glimpse of her face periodically. And I do think that now I'd like to have a Pepsi with my lunch. Just kidding. I only drink water. In 1989, at the age of 17, there are no obvious signs of procedural changes, only that she's about 3 years older. In 1999, at the age of 27, it looks like Sofia may have gotten a rhinoplasty sometime between the age of 17 and 27. Her nasal tip appears more narrow. There's almost like a ball-like quality to it right at the tip, which was not really her original configuration. There are really no other obvious changes. And remember that cosmetic Botox was approved by the FDA in 2002, and cosmetic filler was approved in 2003. In 2000, at the age of 28, I'm seeing here that Sofia likely had some veneers. It looks like that based on the shape of her teeth and the degree of gum show. Interestingly, I saw that Sofia actually went to dental school. Turns out she did just fine without it. In 2001, at the age of 29, I'm not seeing any changes. In 2002, at the age of 30, you can notice that there is some partial lateral nasal wall collapse from the prior rhinoplasty. And one of the reasons why this can happen is because of an aggressive cephalic trim. If you leave less than 7 millimeters of lateral crura, sometimes the cartilage that's remaining can buckle under the natural forces. And this has not just cosmetic implications where the sides look like they're caved in a bit, but also functionally, some people feel like they can't get enough air through their nose. And so some of that nasal dyspnea can occur from this type of over-aggressive procedure that some people get on their nose. Please make sure to subscribe to the channel and turn on all notifications. In 2003, at the age of 31, I'm not seeing any changes. In 2004, at the age of 32, it looks like Sofia may have started getting Botox injections to the forehead, glabella, and crow's feet. You can see how this has created a heaviness of her brows, since the frontalis muscle is the only muscle that actually lifts the brows. So if you're paralyzing it, it can create a heaviness of the brows, especially if the injections of Botox are placed too low on the forehead. But look how full and beautiful her eyebrows look. Amazing. In 2005, at the age of 33, I'm not seeing any further changes. In 2006, at the age of 34, it looks like Sofia may have started receiving cheek filler injections. Her cheeks just look fuller, especially in the more medial component. In 2007, at the age of 35, it appears that Sofia has backed off of the Botox for a bit, and you can now see more forehead wrinkles, but the brows appear a bit higher, and the eyes appear more open. Compare that to the image from 2004. It looks like Sofia is now over-aligning her lips more than she did in the past, but there's no obvious filler use yet. In 2008, at the age of 36, I'm not seeing any further changes, and this is the same in 2009 and 2010. In 2011, at the age of 39, I'm seeing that Sofia may have started to get some lip filler. Follow the border of the upper red lip and notice the irregularity that she did not have prior. In 2012, at the age of 40, there are no further changes. In 2013, age 41, there's a higher quantity of cheek filler that's being placed more medially and into the under eye area as well. In 2014, at the age of 42, no further changes, and this is the same through 2016. In 2017, at the age of 45, it looks to me like her philtrum is lengthening slightly, and this is most likely the result of just the aging process. Sofia also has enhanced filler now in the nasolabial folds, so this has now blurred the transition from the overall lip complex to the cheek. In 2018, at the age of 46, I'm just noticing here that Sofia Vergara's skin is flawless, and there are no further changes seen all the way through 2021. In 2022, at the age of 50, it looks to me like Sofia Vergara may have gotten a facelift. When I look specifically at her left tragal region, I'm seeing some signs of change. It looks to me like she may have had the skin redraped over the tragus, giving it an appearance of a larger tragus. And also, there's a loss of sideburn hair, and we talk about that as a telltale sign of a facelift. And it's very common when you're doing a facelift that this skin gets redraped and removed as excess skin, but usually the small, fine sideburn hairs come with that removal. So you're left with this temporal tuft. In the past, mind you, with old school facelifts, even the temporal tuft was affected and all of this hair was gone. Nowadays, people are left with a temporal tuft, but the sideburn hairs are often gone. And so that, to me, is an indication of a potential facelift procedure. The total cost of these potential procedures is $305,000. And here's a before and after. Since you like this video on Sofia Vergara, make sure to check out our video on Gwen Stefani.